Dr. Conrad G. Maulfair Jr., who is an osteopathic physician. Dr. Maulfair is an osteopathic physician, or DO, certified in radiology. He has a family practice and chelation therapy. He's been in demand for radio and television, and he brings 40 years of clinical experience in helping his patients regain their health and energy with complementary alternative medical modalities. His energy and passion inspires others to actually leave surgery and prescription drugs as last resort in medical choices. He takes his own advice and enjoys the high energy level, the highest energy possible with good health. You can find Dr. Maulfair at drmaulfair.com or purelyyoudetox.com. Thank you, Dr. Maulfair, for coming in today. Secondly, we have Dr. William Borde-Perry, MD. Dr. William Borde-Perry, who's also known widely in the Lehigh Valley on the Dr. Will Show on Prolific Radio. He is a fitness coach and emergency medicine physician who received his education at Princeton University. Dr. Will and his family reside right here in the Lehigh Valley, and he currently practices emergency medicine at Apollo. Please like our pages for updates on Dr. Will's show. And this is Dr. Will Perry.
All right.
And then we have Mr. Charles Dixon. Charles R. Dixon has been working in the drug and alcohol field since 2005 and is currently a member of the National Association of Social Workers. Charles holds a bachelor's degree in psychology from Kutztown University with a specialty in clinical counseling. He is currently a licensed drug and alcohol counselor in the state of Pennsylvania and also holds an international certification as well. Recently, he attained his master's degree in social work from Kutztown University, which specializes in family in environment perspective. Once again, thank you, Mr. Charles Dixon, for coming in.
We are worse off, and I'd like to quote a couple statistics for you. By the most conservative estimates, 225,000 people in the United States are killed by medical drugs every year. 2.1 million are hospitalized for the same reason, and there are 36 million severe adverse reactions to pharmaceuticals annually. Now, are there alternatives? Yes. And that's what kind of all of us, and I suspect all of you, are interested in pursuing. The notion that you get a disease or an illness and as a result you lose health is 180 degrees wrong. You lose your health first, gradually, over time. Two things can't occupy the same physical space at the same time, right? I can't be here and there at the same time. Disease can't happen if health is present. So, in actuality, we do not have a health care system in this country. We have a disease care system. And unfortunately, more often than not, particularly with chronic degenerative diseases, hardening of the arteries, diabetes, arthritis, cancer, we're not really treating the disease. We're treating the symptoms of the disease. So we have a long way to go in this country as far as healthcare is concerned, and it's the philosophy of the healthcare being provided. And that's what I believe, and I'm sticking to it.
All right.
So, when it comes to healthcare in this country, I have to answer yes and no, and I'll tell you why. I have to say, with today's technology, healthcare is actually a little bit better, only because now we have new tools to diagnose certain diseases that we weren't able to diagnose before. You know, in the field of like radiologists, as you know, different blood tests we can test on certain diseases. I mean, we can tell if you have an STD in literally less than 30 minutes. HIV tests that could come back in, you know, less than a day. So we're able to detect certain diseases. Now, here's why I say, you know, there's also a no on top of this. There's other things that influence healthcare too. Is that, you know, I tell people it comes down to human nature. There's two pieces of human nature that, you know, makes healthcare today a little bit worse. two natures. One nature of human nature that I've seen is that the human nature of like litigation, of blaming your problems on somebody else. Now, because we have all these different tools to diagnose certain diseases, we could do CAT scans and everything, we could do ultrasounds. Now we're at a point in America where everyone wants to try to, you know, get results quick, and that relates to fitness as well as to finances. So now we have a situation where people are so ready to sue you over small issues, or sue you over a chronic condition that they had, but maybe you didn't diagnose it, or they think you were the problem, or they don't understand the problem. Now we have doctors, and I'm in emergency medicine, so I'm in the field where doctors now, we over-test. We CAT scan people way too much in this country. We x-ray people way too much in this country. And we had the technology and research through, you know, a type of research called randomized multi-center controls to show that, okay, maybe you don't need to CAT scan every single baby that fell off the bed if they have these certain signs and symptoms. But here's the situation. Because we know nothing is perfect, if a child, 2-year-old child, fell off this table, they come to the emergency room, and mom says, I'm concerned my child fell off the table. And studies have shown in major trauma centers, if that kid does not have any signs of trauma and they're acting normal, and mom says she wants a CAT scan, studies have shown you don't need to necessarily do a CAT scan. You do not have to do a CAT scan. Now here's the dilemma that we're in. And each one of you ask yourself this question. If you came to me in the emergency room, your kids fell off this table, and I said, listen, the mechanism is low, this patient didn't hurt themselves, I think they're okay, I don't think they need a CAT scan, because I'm concerned about CAT scanning this kid now and them coming out with some type of malignancy or cancer later on. You're dismissed, you don't need a CAT scan. You go home, you're kind of unhappy, but you don't understand some of the research behind it. Next day, something happens to your kid, you know, a head bleed, not understanding that nothing of life is perfect. Now you come back and sue me. You take away my house and home because I didn't CAT scan your kid over an imperfect situation just in life. So what is the next physician who hears about that do? Every single person, if mom says I want a CAT scan, we don't ask it, we CAT scan you. Every single person that's an ankle sprain, we x-ray it. That's costing our country billions and billions and billions of dollars because we have a nature that we want things quick. So, you know, we want to get rich quick, or we have vengeance towards the medical field. So now that's a situation where we have the research and technology to diagnose everything, but now we tend to overstudy. Now magnify that problem to, you know, ankle sprains, heart disease. We over-admit too many chest pain. Most of the people who get admitted to the hospital for chest pain, if you're 40 and above, and more than 2 risk factors, they end up okay. But because we don't want to miss that one heart attack patient that could take away my whole family, take away everything that I've worked for the past couple of decades, 1 decade. Guess what? You have chest pain. If you're 40 and above, ask any of the ER friends. If you're 40 and above, overweight, you say you have chest pain, you're getting admitted to the hospital. And that's a waste. So that's one thing. The second part is that about why we're so much worse. People don't realize, and I want to piggyback on what you're saying. If you want to solve the healthcare crisis, don't look towards Obama. Don't look towards the governor. Don't look towards anybody else but yourself. You will be amazed about how many diseases you can prevent through 2 things: diet and exercise. You will be shocked. So she's a believer in the back. You can literally, I mean, let's put it like this, even if healthcare stayed the way it is, you know, everyone's unhappy with the system. If you have diet and every day, I'm not saying everybody has to be super athletic, have, you know, muscle bound. Just do an exercise that you enjoy, whether it's dancing or walking. Do something you enjoy for at least 30 minutes to an hour a day, and get rid of foods that aren't really foods. Like I tell people, cake is really not food if you think about it. You know. So if you just eliminate processed foods and exercise every day, you're not going to need the medical services. You're not going to need all these medications. Then you know how many, I mean, let's put it like this. It's less expensive in the long run. It's cheap, almost free in the long run to be healthy than it is to be unhealthy. There's so many people here, believe it or not, I have patients who are in their 60s and they're on 15 medication. 15 medications. You were born into this world on 0 medications. How do you end up at 6 years age on 15 medications? So, but we were meant to move. We were meant to eat, plants and animals. And this is what I tell people. We were meant to eat plants and animals. We weren't meant to eat these other things out in the world. Now, I'm married. I have kids. So, okay, every once in a while, I have birthday cake. I eat that every once in a while. But every day, do you really need to go to McDonald's every day? Do you really need to eat some of these things every day? So that's my twofold, long-winded answer. I tend to talk too much, but yeah, that's my answer.
Hey, good afternoon. I'm Charles, and these two are a tough act to follow up. I don't know if I can go with what they were talking about, but one of the things that with the healthcare that I've noticed working in drug and alcohol that's very frustrating for me. I've worked with a lot of different people with substance use disorders, whether they had a lot of money, where they would pay for services, whether they had a commercial insurance plan where they worked and they would come to treatment. And I worked with people who were coming from the direction DOC, from prison, and they would get funded through counties or get funded through medical assistance. So I've worked with all different types of patients who had different types of funding sources. One of the things that I see that really frustrates me is that when I have a patient that comes to residential treatment for a substance use disorder, and their insurance company, because they've been working for 30 years for this company or 25 years, and they are a manager at this company, and their insurance does not want them to get the care that they need at this residential treatment center. So they want to say, hey, no, he doesn't meet criteria, let's get him to an outpatient setting, and we have to fight to try to keep him or her in the treatment. And this person is in the brink of losing their job, losing their marriage, losing everything because they can't get services in a drug and alcohol treatment. Now, if you get you get a same person who's been in and out of prison throughout his life and has managed Medicaid, they have no problems getting services, no problems. Like we don't even have they can come through our treatment and get through, and we can refer them to a long-term treatment program or to a halfway house. So what I'm seeing is that the people who are working and who are paying for their insurances, their premiums or whatever, and they try to get treatment, they have a difficult time staying in treatment to get the care that they need. This illness, addiction, doesn't discriminate. So, people, whether you are African American, white, Hispanic, have money, don't have money, are affected by this. So what I'm seeing in the healthcare system is that people who have jobs and who have families and who are paying into insurance companies, they can't get services in drug and alcohol. But people who are coming from prison, they can get as much treatment as they want. And what it comes down to is money. That's what it comes down to. And people are dying. So that's what I've been seeing in terms of CAT scans. Or I don't deal with any of that stuff. So, but I say it's going down. It's going downward, at least in the drug and alcohol field.